When and how to feed a newborn breast versus bottle. Feeding your newborn can feel overwhelming, especially when you're balancing sleep deprivation and all the emotions of new parenthood. You might be asking yourself, how often should my baby eat? Should I choose breastfeeding or bottle feeding? And how will I know if they're getting enough? In today's video, we'll break this down step by step. We'll cover how often to feed a newborn, the differences between breastfeeding and bottle feeding, and how to know which approach is right for you and your baby. I'll also share practical tips for making feeding easier, whether you're nursing, pumping, or using formula. By the end, you'll feel confident about feeding your little one and understand what's normal during those first precious months of life. Newborns have tiny tummies, so they need to eat often, usually every 2 to 3 hours or 8 to 12 times in a 24-hour period. If you're breastfeeding, this may be a little more frequent, especially in the first few weeks as your milk supply is being established. If you're using formula, most babies will take about 1.5 to 3 ounces, roughly 45 to 90 milliliters every 2 to 3 hours. The amount will gradually increase as they grow. But remember, every baby is different. Some will eat more frequently, some a bit less. One of the best ways to know it's time for a feed is by watching for hunger cues. Early cues include smacking, lips rooting, turning their head toward your hand or breast, and sucking on their hands. Crying is actually a late sign of hunger, so it's better to feed before they get to that point. As a general rule, never let your newborn go more than 4 hours without a feeding, even at night, until your pediatrician says it's okay to stretch those intervals. Breastfeeding is often called nature's perfect food for newborns, and for good reason. Breast milk is packed with antibodies, vitamins, and healthy fats that support your baby's immune system and brain development. It also changes composition as your baby grows, meeting their nutritional needs at every stage. Research shows that breastfed babies have a lower risk of ear infections, respiratory illnesses, and even certain allergies. For moms, breastfeeding can lower the risk of postpartum depression and certain cancers. In the first few days, your body produces colostrum, a thick, yellow, antibody-rich milk often called liquid gold. It's small in volume, but powerful in nutrition. After a few days, your milk supply will increase and become thinner and whiter. One of the keys to successful breastfeeding is positioning. Your baby's mouth should cover most of the areola, not just the nipple, and their chin should touch your breast. This ensures a deep latch, which prevents pain and helps them get enough milk. If breastfeeding feels painful or you're unsure about your baby's latch, reach out to a lactation consultant as soon as possible. Help in those early days can make a big difference. One of the biggest worries new parents have is my baby eating enough? Here's what to look for. After the first week, most newborns will have at least 6 wet diapers and 3 for stools per day. You'll also notice steady weight gain and periods of contentment after feeds. Another sign is swallowing sounds during feeding. If you hear little gulping noises, That's a good indication they're getting milk. And don't forget about growth spurts. Around 2 weeks, 6 weeks, and 3 months. Your baby may suddenly want to eat more often. This is completely normal and usually lasts a few days. If you ever feel unsure, keep track of their diapers and bring those notes to your baby's doctor. Pediatricians are very used to this question, and they can reassure you with a quick weight check. Now let's talk about bottle feeding. Whether you're exclusively using formula or pumping breast milk to bottle feed, this can be a wonderful way to feed your newborn and still enjoy bonding time. Formula feeding is very safe and provides all the essential nutrients your baby needs to grow. Most standard formulas are cow's milk-based, but if your baby has allergies or sensitivities, your pediatrician may recommend a hydrolyzed or soy-based formula. The general guideline is about 2.5 ounces, 75 milliliters of formula per pound of body weight per day. So, if your baby weighs 8 pounds, they may drink around 20 ounces in 24 hours. But again, every baby is unique, so follow their cues. If they push the bottle away or turn their head, they may be full. When preparing formula, always follow the instructions on the package carefully. Use clean, sterilized bottles. And never add extra water or formula powder. This can upset their stomach and affect their nutrition. If you're using pumped breast milk, remember that freshly pumped milk can stay at room temperature for up to 4 hours and in the fridge for up to 4 days. Whether you're using formula or breast milk, safe bottle feeding is important. Hold your baby semi-upright, never flat on their back, to reduce the risk of choking and ear infections. Keep the bottle angled so the nipple is always full of milk, which prevents your baby from swallowing too much air. Burping is also essential. Pause halfway through the feeding to gently burp your baby, and again at the end. This helps release swallowed air and keeps them comfortable. Finally, pace. Feeding. Unlike breastfeeding, where babies can self-regulate, bottles can flow quickly. Take breaks to mimic the natural rhythm of nursing. This helps prevent overfeeding and allows your baby to recognize when they're full. Some parents choose to combine breast and bottle feeding, and that's perfectly okay. Maybe you're returning to work, or you want a partner or grandparent to help with feedings. The key is to establish a good breastfeeding routine first, usually after 3 to 4 weeks, before introducing a bottle. If you're pumping, aim to pump at the same time your baby would normally nurse to maintain your supply. A high-quality breast pump can make this much easier. You can also store breast milk in the freezer for up to 6 months, which is great for building a small backup supply. And don't worry, most babies adapt to switching between breast and bottle if you introduce it gradually and use a slow-flow nipple. Feeding a newborn isn't always smooth sailing, so let's quickly talk about a few common challenges. If your baby spits up often, try feeding smaller amounts more frequently and keep them upright for at least 20 minutes after each feed. If they seem extra gassy or uncomfortable, experiment with different bottle nipples or feeding positions. For breastfed babies, Sore nipples are common at first. Using a good latch technique and applying a soothing nipple cream can help. If you're struggling with milk supply, try feeding or pumping more frequently and stay hydrated. Your body needs fluids and calories to make milk. If any feeding issues persist or your baby seems lethargic, isn't gaining weight, or shows signs of dehydration like fewer wet diapers, call your pediatrician. It's always better to check than to wait. Feeding your baby is about more than nutrition. It's a time for connection. Hold them close, make eye contact, and talk or hum softly. These little moments build trust and strengthen your bond. Remember, there is no perfect way to feed a baby. Whether you breastfeed, bottle feed, or a combination of both, what matters most is that your baby is loved, fed, and thriving. So give yourself grace. You're learning together. And every feeding is a step forward. If you found this video helpful, please give it a like and subscribe for more newborn care tips. And let us know in the comments, what feeding questions do you still have? We'd love to answer them in a future video. Until next time, take care of yourself and your little one.